Hello, my name is Jillian McKnight, and today I will be presenting on Parkinson's disease. Parkinson's disease is abbreviated PD. I will be explaining Parkinson's disease, discussing the symptoms, who is most susceptible, the causes, and treatments of Parkinson's disease. So first, what is Parkinson's disease? Parkinson's disease is a chronic degenerative disorder of the central nervous system characterized by fine muscle tremors, rigidity, and a slow shuffling gait. Parkinson's causes movement disorders or voluntary actions that tend to get worse over time. In addition, PD damages the neurotransmitters in the brain that release dopamine, and dopamine is essential for regulating movement. Symptoms of PD. So, symptoms can vary for each individual and may start as is insignificant or unnoticeable. Symptoms usually start on one side of the body and then can affect both. According to the Mayo Clinic, common symptoms include tremors, which is rhythmic movement of a body part that's out of your control or involuntary, bradykinesia, extreme slowness in movement, rigid muscles, and ataxia being stiff muscles in any part of the body, and it could feel tense or painful. Poor posture or balance, so you could have a hard time standing upright or keeping yourself from falling or losing balance. Speech changes, this could mean speaking softly or quietly, slurring your words or hesitating before talking. The sound of your voice may even change too. It could be flat or monotoned without typical speech patterns. And it could also cause dysphagia, which is trouble swallowing. Urinary incontinence, which means your inability to control your bladder. And then it can also affect non-motor symptoms such as inducing depression, anxiety, constipation, and sleep problems. So who is most susceptible for PD? People over the age of 60. Men are more susceptible than women. It is a genetic disease as well, so those with a parent or sibling affected have twice the chance of developing Parkinson's disease. There are also environmental causes, such as exposure to chemicals like pesticides or herbicides, working with heavy metals or detergents, but researchers say these factors aren't as likely to cause Parkinson's disease. And the last one is people who have had repeated head trauma, such as professional athletes or boxers, or people who have been in multiple accidents. What are the causes of PD? So we have genes and environmental factors, as we mentioned in the previous slide. And then, according to Mayo Clinic, other factors are being researched, such as the presence of Lewy bodies. And Lewy bodies are clumps of proteins in the brain that are associated with PD. There's also something called alpha-synuclein found within the Lewy bodies, and the alpha-synuclein is a protein found in the Lewy bodies, and individuals with PD have alpha-synuclein found in the spinal fluid. In addition, other causes could be altered mitochondria. So mitochondria are the things that create energy for the body and are the powerhouse of the cell. So people with PD, researchers have noticed, have damaged mitochondria in their brain. So currently there is no cure for PD, but there are treatments that can make living with PD more manageable. The first is physiotherapy, and the goal of this is to relieve muscle stiffness and joint pain through manipulation and exercise. Next, there's occupational therapy, and this is to help individuals complete activities of daily living, such as eating, going to the bathroom, or bathing. There's also speech and language therapy to relieve difficulties swallowing or pronouncing words. It's also important to keep a good diet and to eat enough fiber and enough water to avoid constipation. You also want to eat enough salt to avoid low blood pressure, which could make you dizzy or lose balance when you're standing up. There are several medications used to treat some of the symptoms of PD, such as tremors and movement problems. The three most common medications are levodopa, dopamine agonists, and monoamine oxidase B inhibitors. The levodopa medication is absorbed by nerve cells in the brain and turned into dopamine. It can be taken by mouth and it acts to relieve sickness, tiredness, and dizziness. The dopamine agonists act as a substitute for dopamine in the brain, similar to levodopa but has a milder effect. And then monoamine oxidase B inhibitors act to block enzymes that destroy dopamine in the brain. There is also an option for surgery and a technique called deep brain stimulation. And this involves surgically implanting a pulse generator similar to a heart pacemaker inside of specific areas of the brain with wires. So this causes a tiny electric current to be produced, the pulse generator, and it stimulates parts of your brain that are affected by PD to try to eliminate some of those symptoms. So here we have a list of words and medical definitions that I use throughout. To review again, activities of daily living, ADL, are basic routine tasks that most individuals can complete on their own. Ataxia is lack of muscle coordination during voluntary movement. Bradykinesia is extreme slowness in movement. The central nervous system is made up of the brain and the spinal cord. Chronic means a disease of long duration. Deep brain stimulation involves implanting electrodes within areas of the brain. The electrodes produce electrical impulses that affect brain activity to treat certain medical conditions. Dysphagia is the inability or trouble swallowing. Gait describes the manner of walking. Occupational therapy, OT, consists of activities to promote recovery and rehabilitation to assist patients in performing activities of daily living. A pacemaker is used to treat arrhythmia, and it's a battery-powered device, can be attached externally or implanted temporarily or permanently under the skin with connections leading to the heart to regulate the heartbeat. Parkinson's disease, PD, is a chronic degenerative central nervous disorder characterized by fine muscle tremors, rigidity, and a slow or shuffling gait. This slow or shuffling gait is caused by a gradual progressive loss of control over movements due to inadequate levels of neurotransmitter dopamine. Physiotherapy, or sometimes called physical therapy, PT, is a common treatment that can help you recover after an injury or surgery or manage symptoms from a health condition that affects how you move. It's a combination of exercises, stretches, and movements that will increase your strength, flexibility, and mobility to help you move safely and more confidently. Tremors are rhythmic movement of a body part that is out of your control. Urinary incontinence is the inability to control your bladder. And here is some of my works cited. And works cited continued. Thank you for listening. I hope you have a better understanding of Parkinson's disease now. Have a great day.